fear in the minds of patients undergoing cytoreductive surgery and HIPEC is how will be the time after surgery? Will there be a lot of side effects? Will there be a lot of pain? Will the recovery period be very tough? Cytoreductive surgery and HIPEC is more complicated than most other cancer surgeries. The surgery itself takes 6 to 8 or even 10 hours to perform and involves a large cut that is placed on your abdominal cavity. It is only logical that the recovery from such a complicated surgery will also take longer than what it takes after most other surgeries. But nowadays there are many treatments, there are many ways for minimizing pain and fastening the recovery. Nowadays we do something called rehabilitation, that is optimizing the patient before the surgery. In the time period before the surgery, which could be a few weeks or a few months, the patient is asked to do physical and respiratory exercises, the medical conditions are optimized, and the nutritional status is also optimized by giving appropriate supplements when required. By following these practices, the post-op recovery of the patient becomes faster and the complications are also reduced. On an average, following cytoreductive surgery and HIPEC, patients spend 10 to 12 days in the hospital, of which 1 to 2 days are spent in the ICU. Pain is usually not a problem after this surgery because we have a lot of newer and very effective painkillers. There are pain patches and some patients get an epidural catheter, that is a tube placed in the back through which the painkiller is given continuously. We start feeding early. Water and clear liquids are started as early as the first day of surgery. Similarly, patients are made to walk and move out of bed as early as the first day following surgery. A common post-operative thing is that the intestinal function takes time to return. After any abdominal surgery, usually the intestines start functioning on day 2 or day 3. Following cytoreductive surgery and HIPEC, it could take 5 or even 7 days for the intestines to start functioning normally. And during this period, the patient will not feel hungry or the appetite will not be good. For patients who are very weak or who are nutritionally not in a very good state, or when a very extensive surgery has been performed, we often give intravenous nutrition to maintain the calorie intake and the protein intake during the first week of surgery. The period after discharge at home can be particularly tough for some patients. There may be a loss of appetite and weakness, and it is important to keep eating small frequent meals every 1 to 2 hours. Similarly, it is important to maintain a good intake of fluids. Sometimes patients become very weak and are not eating adequately and may require some intravenous fluids. For patients who come from other cities or from far, we advise them to be in touch with a local doctor who can come and see the patient from time to time and give injections and fluids when required. Similarly, it is important to not keep lying in bed all day, get up and walk around and do some minimal exercise or work that is possible. This period is tough, but at the end of 1 or 2 months, almost all the patients will come back and start leading their normal lives. It is important to keep the spirits up and not lose hope, and rest assured you will recover from this surgery.